Hi, it's Henry Shelford, chairperson of SarcoidosisUK. We are really pleased that and honoured that Dr. Robina Coker has made some time for us and for everyone with sarcoidosis to talk through her latest advice on COVID-19 and sarcoidosis and what the current advice is. Obviously, a lot of things have changed since we last spoke. In particular, the pandemic numbers have increased substantially, and we're obviously all now the government advice has become much more much stronger. But obviously for sarcoidosis, there's still a lot of information we want to know. So I'm going to say hello to Robina.
Hello, Henry. Good to speak to you.
Very well, very nice to talk to you. Thank you again for your time. So Dr. Robina Coker is a consultant and honorary senior lecturer in respiratory medicine at Hammersmith Hospital and Imperial College London. She's clinical director of Northwest London NIHR Clinical Research Network, one of 15 CRNs in the country. So first, the most important question, how have you been?
I'm very well, thank you. Yes, and you're well?
I am well, thank you very, very much.
Good.
So how is it in the NHS now? What are the wards like?
Well, I'm not working on the front line at the moment, but I understand from my colleagues, because we have regular, some face-to-face, but mostly video conference and teleconferences, that we do still have capacity. We have created a lot of extra capacity in our trust, as I know trusts around the country are doing. We are expecting a surge over the weekend, and there are a lot of preparations for that.
And is there why over the weekend in particular? Obviously, we're seeing the numbers going up and up and up.
Yeah, well, I guess it's just that, we need to be ready from the weekend. It may not happen Saturday and Sunday, it might be Monday, but in the next few days. And I guess the weekend is a time where we have to be particularly careful to make sure there are adequate resources available.
And are people feeling they've got the sort of PPE they need? How are you feeling about that?
Yeah, my understanding is that yes, we do. Yeah.
And so you're not yet on the front line of this, so you've not seen any COVID-19 cases personally?
I haven't seen them personally. Obviously, I'm aware, we're doing some remote reviews, and so I have access to imaging and clinical information, and I'm liaising with my colleagues, but I haven't seen any personally, no.
And have you talked to any colleagues about patients with COVID-19 and sarcoidosis?
No, that hasn't happened yet. I haven't been contacted about anyone yet. I'm hoping everybody's at home and staying safe. Isn't going to catch it.
Well, that is certainly what we've advised, and actually that moves perfectly onto some of the questions that have been sent in. And so from the we've had a lot of questions on shielding, and so yes. from the government, shielding is a measure, and so just a quick definition for everyone watching. So shielding is a measure to protect extremely vulnerable people by minimizing interaction between those who are extremely vulnerable and others, and that means those who are extremely vulnerable should not leave their homes, and within their homes should minimize all non-essential contact with other members of their household. And under the sections from the government about who should be shielded, we have section 3 is people with severe respiratory conditions. Section 4 is people with rare diseases and inborn errors of metabolism that significantly increase infections. And section 5 included people on immunosuppressant therapies, which are often used in sarcoidosis, sufficient to significantly increase risk of infection. Now, we've been advising shielding for some time, and the British Thoracic Society, I know, has been doing a lot of work, and I know you are very involved with them, has now also advised all people with ILDs and sarcoidosis, and has specifically mentioned sarcoidosis, and we've been working with them, and I know you have, that they should shield. And actually that brings us, so Karen wrote in saying many of us have not received a shielding letter from the NHS. We're being told by our GPs that we do not meet the criteria for a letter. Is this going to be reviewed? And will we now be included in the criteria? And I'm pleased to report that I think due to some of your work that the British Thoracic Society has said people with active sarcoidosis should now, because they have now advised it, the government is now advising people with sarcoidosis should be shielded, and people should now be getting the letter. And if they're not, there's a statement up on the BTS site, and that they can point their GPs to. But I think those letters are coming out, but there will be a few days. So I think first of all, thank you for your work on that.
Not at all, thank you. I mean, I would just say for our hospital alone, there are around 600 letters that need to go out, and I need to screen my patients to support the admin team who are working away very hard to produce these letters. But of course, they do have to be tailored to each patient, and they have to have your NHS number on them. So they're not just generic letters that go out. They do have to be, they require some input from the admin staff. And I have a super team who've really risen to the challenge. But as you can imagine, for our centre, around 500 or 600 patients is a lot. And I need, as I say, to identify exactly the patients who need letters first. So bear with us. The letters are on their way, and I know they are being received, and unusually they are being sent out first class, but it may be a while before you get yours.
No, well, thank you. I think that's going to put a lot of minds at rest, knowing that that process is happening, and an idea of how difficult it is. What isn't quite clear is for the implications for people with non-pulmonary sarcoidosis and for sarcoidosis in remission. So what's your advice to those patients? Yeah,
so it isn't clear, and it is a grey area. And I think that patients should initially ask their GP, because their GP may be very supportive and have a very good idea of their condition and be able to advise. If they can't do that, then I suggest they try and contact their local ILD service, their specialist. There may be some remote support. There may be a generic email. Every service is different, but there is support available. Because I suspect the clinicians actually looking after you will know best whether they think you're in the group that should be shielding. I mean, we've taken the view here that people who have active pulmonary sarcoidosis must shield. And obviously, going back to the subject of one of our other videos a while ago, patients with cardiac sarcoid should shield. And anyone on immunosuppression should definitely shield. But in a group who are in remission and otherwise very well, I think that has to be up to the individual clinicians looking after you. So you should seek advice. I think if you're worried, it's good advice to shield anyway, regardless of whether you get the letter. So, you know, if you are concerned, that is the safest and most prudent option. And I think there's nothing wrong with that at all. But it may take a while for people to make a judgment call on whether actually you fall into the category who should receive a shielding letter. And I think that is up to the local teams and specialist teams to decide.
Okay, and yeah, and I think that's been our advice too, that talk to your consultant or GP, but being prudent makes sense. And I think there's a reminder that people are self-isolating for two reasons, right? For themselves and for the NHS, that it's important that people who have these complications, who are therefore going to be much more challenging to treat, and who may be in much more danger, want to make sure that they don't themselves get ill or put that pressure on the NHS. So it's for two reasons.
Absolutely, absolutely. It's your own safety, and it's the safety of everybody else as well. So it's a communal effort.
It is that, and so I think that leads quite. I think you've answered, but we'll just say that Nikki. So Nikki said her sarcoidosis is in her lymph nodes, but not her lungs. Should she self-isolate? And Katie said it's in her lungs and lymph nodes, but it was in remission, but recently diagnosed for sarcoidosis in her eyes, and has been given steroid eye drops. Does that mean that her sarcoidosis is active and she should shield? And she also mentions she's diabetic, has fibromyalgia and ME, which I would have thought that diabetes, I think, does put you on the shielding list. Actually, do you want to speak to that? Because I'm not sure.
Yes, so I think it would be prudent, but I guess she may not get a shielding letter.
Yeah.
So certainly diabetes puts you at extra risk.
Yes, it's not on. I think it's not. It's not.
It's not on the list. No, at the moment it's not. So I think, yeah, absolutely prudent to shield, but you may not get a letter.
Yeah, and I think to your earlier point was like, look at where these things are less clear. So I think where we're clear is active pulmonary sarcoidosis, active cardiac or any cardiac sarcoidosis, or on any kind of plinizzarone or other immunosuppressant, you should be shielding.
Yeah.
For those other more along the spectrum of sarcoidosis and the different levels, then that's time to be pragmatic and talk to your consultant and GP and let them advise you.
Yes. But if the system is overloaded and you can't get through, then if you want a shield, that's not going to do any harm.
Yeah.
Just be aware you may not get a letter.
Yeah. And for people in remission, I think, what's your advice to those people?
Well, again, I think it's going to be up to individual clinicians how they manage that. So I suspect the GPs will say no. I suspect they won't get a shielding letter immediately, but if they want to be prudent, then there's nothing to stop them shielding.
Okay, fair enough. Great, thank you very much. So shielding, moving on with those questions. So Sarah asked, and I think this is quite actually the complexities of shielding, and I think she does a good job of raising those issues. For those of us who advise to shield at the moment, can you explain what the risk is from going outside for a walk where it's quiet and I can keep away from people, and I would like to continue to do my morning walk? Is it really too dangerous? And she also asked her husband is self-isolating, she's shielding. Can I sit? I'm being advised to shield, but can I sit in the same room as him? And I think that talks to like, this is a long haul, right? We're going to. It's actually very hard to do the shielding. That's partly why people who don't need to, and the pressure that's then put on friends and family, like that balance that we all have to work out.
Yeah, it is a balance, and I think we have to be pragmatic, and I think that is the tone from the government, the UK government, is that we do have to be pragmatic. And I think the UK government has recognised that it is important for people to get out in the fresh air and get some exercise. It's how they do that, how often, and what happens when they are out. So clearly, I think the message has got out now that you should really be within a mile or so of your home. The idea is not to get into the car and drive to some beauty spot, however tempting that might be. And I'm sure none of you would do that. But if you can walk outside safely from your home without coming into close contact with other people and socially distancing, so keeping at least 2 meters away from people for a short walk, perhaps early in the morning, if that's safe for you in your area, and you can do that, that may be a pragmatic way of managing this over the long term, because obviously the initial guidance was set up when we thought this might be 3 to 6 weeks. It looks as though it's going to be going on for quite a lot longer. But you just have to bear in mind that isn't the shielding advice. So I think you have to weigh up in your own mind the risks and benefits of doing that for you. Some people may find actually they've got a garden, they've got a balcony, they can do exercises at home, and that's enough. And I think if you've got that, you may well want to stay at home. If you really haven't got any other way of getting out and getting any exercise, then yes, you may want to do as Sarah suggests. I think in terms of household contacts, ideally people should be in separate bedrooms and using separate bathrooms. And clearly that's not possible for everybody, but if you can make that possible, that's great. And I think if you're sitting in a room with somebody, you need to be as far away from them as possible. This is all very difficult. it's very difficult for everybody. We're not used to having to do this. And of course, a number of NHS staff are isolated from their partners and their families for the same reason, because they have a partner who's highly vulnerable. So we are seeing this quite a lot. So extraordinary times need extraordinary measures. And I would say as well, you want the room to be as ventilated as possible. That will get easier as it gets a bit warmer this weekend. Public Health England advice is that rooms should be well ventilated, because clearly what you don't want is to have people sitting close together in stuffy rooms for any length of time.
No, thank you. And we've had people are able to ask questions as they come in, and so we have actually I think Rhonda also asked the same question. Can she go on a short walk on her own if she's shielding? And I think the answer is be careful. But yes, certainly that's what my elderly parents are doing. They're going out early in the morning to go on a walk. I think they're getting fitter than they've ever been.
Yeah.
Not that interested in walks before.
Yeah.
Now doing a lot. So we've had some questions about medication. So John asked, does taking 10 milligrams of prednisolone make you vulnerable to coronavirus? And actually Duncan asked the flip side of that. So does being immunosuppressed actually help us against COVID-19 due to the virus attacking our bodies with our immune system?
They're all very good questions. I don't think we know. Obviously the view at the moment is that if you are immunosuppressed, and that includes steroids, you are more at risk, and hence the advice on shielding. But we don't have good data yet, and the data will improve as we go along, and I don't think we know. And yes, it's a good question about would immunosuppression prevent a cytokine storm, and which immunosuppression would prevent a cytokine storm, but we don't know that. For
people who don't know, what's a cytokine storm?
Well, it is effectively an exaggerated immune response to the virus, because of course none of us have met the virus before. And so in some cases, the immune system, if you like, overreacts, and you get an uncontrolled release of cytokines, which then produce the sort of reactions that you see in the lungs and so on. So I don't think we know is the answer.
Thank you. And I think that's the unfortunate thing, and that's why all the shielding and many of the measures is because we don't know, and people are trying to make the best estimate based on what we know, but with a bias towards being safe, which is hence what we're all doing. We've had a message in from Melanie saying her mother-in-law has coronavirus and sarcoidosis and is now recovering. So that's at least one person who we know.
Well, I think that's excellent news. I think that's really good, and it's encouraging to hear those stories. So well done, good recovery.
And we've had Robert asking, "I'm not on medication. Do I still need to be careful?" And I think we've talked to that. Wendy said, "I've had 3 consultants. Where will my letter come from?" Alan, who's monitoring this, has said actually he spoke to someone today who is in that exact position, and they've had 3 letters. Does that sound likely to you?
Well, it's possible, because the difficulty is knowing exactly who's going to coordinate it. So we had the go-ahead to give out these letters last Friday for our patients for ILD and sarcoidosis. And the difficulty then is who sends out that letter. And I think it varies from area to area. And in some cases, the CCGs and primary care are coordinating letters. But if medication is prescribed by the hospital, then I think in many areas, the CCGs expect the hospital to deal with that. And I think it's going to vary. I think if you've got 3 letters, actually, that's good, because it shows that lots of people recognise that that's the situation. It's inevitable. I would rather people had more than 1 letter than that they didn't get one when they needed one. Absolutely.
And thank you. You're going, what you said, 600 tailored letters you're writing and processing. And you're one order, consultant in the entire hospital. It's a lot of work. Someone's written in going Adam said, I have pulmonary sarcoidosis, pulmonary fibrosis, and I'm on methotrexate. My GP says I don't meet the vulnerable criteria. What do I do?
Well, you could talk to I would suggest you contact your specialist hospital. There will be some admin support, and ask them for a shielding letter.
Yeah, and I think, talk to your. I think that's very good advice. Talk to your consultant, and I think also the good work that you've been doing with the British Thoracic Society that we've also been involved with to get sarcoidosis on the list, which
Yes.
is a very, very important change.
Yes.
Yes. As a rare disease, we get missed all the time. It is, and we obviously know of people who don't get the treatment they need because of those kind of issues, and so
Yes.
To make sure that we've been involved with this is very important, and thank you. I've got 2 more questions, if that's all right. Catherine's asked, does hydrochloroquine make you immunosuppressed?
Interesting, that one. I mean, there's a lot of interest in hydroxychloroquine at the moment, of course, in clinical trials. Yes, it is an immunosuppressant, but there is interest in it as a possible treatment. One of the things that's become evident to us here is that there is now difficulty getting hydroxychloroquine, even for patients already established on it. So repeat prescriptions are quite tricky because local pharmacists in some areas have run out. And that's because stocks, I think, have been requisitioned centrally, at least in part for clinical trials. So we don't know about hydroxychloroquine, but it's being tested.
Fair. Now, we've had actually a very good question sent in, which is from Nicola, which is just, what should we do if we get the virus?
So you need to follow the NHS 111 advice. Obviously, I'm sure you've looked at it, so you know it. Call them or contact them.
And I think it's a good point to say that people need to update themselves on it, because it does change.
It does change.
So don't assume you know it. Go and look it up. And there are some triggers that they talk about, particularly shortness of breath, I believe is one of them, where they say, like, so just having the virus, don't call 111. You need to look after yourself. Get good sleep, fluids, and treat yourself as you would the flu. But if you start getting shortness of breath, if you start getting more severe symptoms, at that point you should call 111.
Yes, absolutely. So the advice does change. The other thing I think is really important is this is an opportunity, and I've said this before, to get your documentation from your specialist onto your phone, or if you haven't got a smartphone, into a folder. So have a copy of your latest clinic letter, have your lung function if possible, have your medication list, either scanned onto your phone in a place you can find it, or have it in a document in a hard copy folder, and have that with you, because this will be enormously helpful if you do have to speak to a healthcare professional, if they've got your history, and that will make a big difference to your care, having that information.
That's very important. So thank you. Actually, that leads to a question from Duncan, which I imagine a lot of people have thought about. And he says, if we contract COVID-19 and are hospitalized, are we best to not inform the doctors about sarcoidosis in order to avoid being denied treatment through triage?
No, I think you have to be honest. You have to be upfront. The triage will depend on all sorts of factors, and people need to know you've got sarcoidosis. They need to know what treatment you're on, so that they can either stop some of it or escalate other parts of it. You might possibly need an increase in steroid dose. You might need to stop alternative immunosuppression. So I think for doctors to look after you properly, you absolutely have to give them the information and the facts.
Yeah, because they then might not treat you properly, give you the treatment you need. And in terms of risk factors for COVID-19, I think there are considered to be a lot more higher on the list, which are, your age particularly is obviously the one that is being talked about being triaged on. I think it's also quite important to make clear that at the moment there is no triaging going on, and the Nightingale NHS Nightingale Hospital is open and has beds, so there isn't this issue that there aren't enough beds, and what we're doing right now, by all being careful, is flattening that curve so we don't get to that point.
Yes, and the system has capacity at the moment. Exactly. Yeah.
How close is your hospital to capacity?
I can't answer you this morning, sorry.
That's right, fair enough. I'm not sure.
But certainly yesterday evening we had capacity.
Fair enough. Fair enough. And we know NHS Nightingale is now taking its first patient and has a lot of beds available. I think, well, that's the great majority. That's all our questions. And I think we've overrun slightly. You've been very generous with your time. So thank you very much.
Thank you, Henry. Take care.
It's hugely important and valued by a lot of people, and so thank you very, very much. And thank you. There's a lot of work you're doing in the background, for instance, getting sarcoidosis on the list with the British Thoracic Society that people otherwise wouldn't know about. So I know how hard you're working. So thank you very, very much indeed. And stay safe, look after yourself, and obviously to everyone watching, stay safe and look after yourself too.
Thank you, and you. Yeah.
Thank you very much, and bye-bye, and thank you very much. Bye, Robina.
Goodbye.
Bye-bye. Bye-bye.
Thank you. Goodbye.
And goodbye, everyone else. Thank you very much indeed for watching. Our last shout out has to be that wow, this is a time where the charity is trying to do a huge amount, and everyone is working very hard. But obviously our money has dried up. We would normally be having lots of events right now, and people kindly sponsoring people, and those just aren't happening. And so we, like many charities, have seen our income fall off a cliff. But obviously we are continuing to work at much more than 100%. We've seen numbers of calls, emails going up by, I think it's 300% year on year. And so we've got a lot of work to do. We're trying to make a big difference. We've been working obviously with the British Thoracic Society, getting sarcoidosis on the list of conditions that need to be shielded. We are putting out information to try and help people know what to do with their circumstances. Sarcoidosis is very complex. So we are a rare, not well understood disease, meeting what is now a pandemic, but also not well understood disease. And so there's a lot that can fall in between the cracks that we don't want to happen. We're obviously trying to help as many people as can. So if you are able to donate, now would be a great time. In particular, if you're able to, putting in a monthly donation to carry us through the pandemic would be very helpful and very important. It's obviously, this is going to be, I know we're all set up for, the initial was like it's going to be quite short. It's very clearly going to be months and months and months. And so your support now is more than anything. We're going to do some videos on Facebook Live, about Facebook birthdays. So if you're having your birthday, and I'm happy to making it a fundraiser and saying, you can't have a party, but could you give some money to Sarcoidosis UK? Those are great things. They are really important to us, and obviously in this time going to be more important. So thank you for that. Thank you for considering that. And in the shop, we've got things to help you. We've got our badges. My cough is not contagious. We've got posters that you can download and print, or we can send you that say, I've got an underlying condition. Please be careful around me. As ever, so they are on the shop, so they can be bought. And Alan has taken the badge making machine home with him, so he can make them at home. So we can still keep them. But as ever, obviously we send them out. We put a price on them, which is helping us run, but it's contributing to that. But actually, also, if you don't have the money, we will obviously send them out to you for free. They're important. So look, thank you everyone for all you're doing. Thank you for your support. It's incredibly important. If there's more we can do, let us know. We are here. We're here to help. This is what we are put on the face of the earth to do. and if you've got more questions, please send them in. We'll answer them. What we're doing is adding them to our FAQ, so they're building up. So because we're getting so many inquiries, we know that people want the answer. So if you check the FAQ, see if the answer's there, but if there's more you want to know, send it in, because then we can add it to the FAQ and then we help many more people. So your question is very rarely something that only you want to know. So it's good for us to build that up. But yeah, so any suggestions for us, obviously, also gratefully received. We're looking for ways, well, we're trying to help in every way we can. Thank you again. Thank you for your support. Thank you for watching. We are here for you. Take care of yourself. Take care of others. Be kind to yourself. Let others be kind to you. And thank you. And I will talk to you soon. Goodbye. Goodbye.